How does mental health impact obligations and rights towards affected patients in worship? So there's an impact of how somebody who suffers from mental illness, their worship may be impacted, and then what is the ruling related to that in terms of the obligations of them worshipping. So salah, zakat, Sawm, Hajj, and various other things. The other element here is about social customary activities. We will call mu'amalat. Okay, so these are things like, for example, transaction, buying, selling things, contractual arrangements that they may have, even things, for example, nikah, talaq, and various other things like that. And then finally, something about punishments and crimes, or hudud, jinaya. So do they have a responsibility? Are they accountable for the things that they commit whilst in the state of psychosis, for example? And this kind of discourse is important as well. So there'll be some discussion about that in the course. The other element related to these is rulings related to therapy. So, for example, physical therapy is related to use of mind-altering drugs. So we use morphine-based drugs maybe for pain. In certain instances, we may use antidepressants, antipsychotics, and we may use other sort of treatments like marijuana and various cannabis and various other things like that, where people do use them to calm certain individuals. Not necessarily in a medical setting, but these kind of patients do ask whether it's permissible for them to use such sort of substances. So psychological therapies also that are not necessarily medically or drug related, like psychotherapy, hypnotherapy, psychedelics, relaxation through music and singing. That's an interesting area. What's the permissibility regarding that? And then finally, spiritual therapies like ruqya, using ta'weez or talisman, and using jinns and things like that. So that's a separate discourse that will be also part of the course later on.